Hello, this is Alex. Welcome to my channel where I discuss common and unusual health conditions and their treatments, both conventional and complementary. This video is part 1 on alcoholism. In this video I discuss what alcoholism is, plus the symptoms, withdrawal symptoms, consequences and health effects. Lots of valuable information, so be sure to stay till the end. Also, stay tuned for part 2 on alcoholism, where I discuss the complications and causes of alcoholism and conventional treatments, and part 3 on alcoholism, where I discuss complementary treatments. I will link these videos in the description below. Also, if you enjoy this content, please hit the like button, subscribe to my channel, and hit the notification bell and click all so you won't miss a video. Now let's get into part 1 on alcoholism. What is alcoholism? The World Health Organization defines alcoholism as alcohol consumption by an individual that exceeds the limits accepted by the culture or impairs the health or social relationships. Alcoholism is considered a chronic illness of undetermined cause with an insidious onset, and recognizable symptoms and signs proportionate to its severity. An alcoholic is classed as having a severe dependence or addiction and a cumulative pattern of characteristic behaviors, tolerance and physical dependence. Those who drink large amounts regularly eventually become tolerant to alcohol and may have high blood alcohol levels. Tolerance is caused by adaptational changes of central nervous system cells. The physical dependence accompanying tolerance is very strong, and withdrawal from alcohol can have serious effects that may lead to death. Those who are tolerant to alcohol are often cross-tolerant to other central nervous system depressants, such as barbiturates, non-barbiturate hypnotics and benzodiazepines. Late symptoms of alcoholism. Common late symptoms include blackouts, dizziness, slurred speech, incoordination, nervousness, irritability, tremors, heart disease, high cholesterol, liver disease, blood sugar disorders, and high blood pressure. Withdrawal symptoms of alcoholism. Withdrawal symptoms usually begin 12 to 48 hours after stopping alcohol. Mild withdrawal symptoms include tremors, weakness, sweating, hyperreflexia, and gastrointestinal symptoms, and in some cases, general tonic-clonic seizures, usually no more than 2 in short succession. These are also known as alcoholic epilepsy or rum fits. Abrupt abstinence from prolonged excessive alcohol consumption can cause alcoholic hallucinosis. Health effects of alcoholism. Alcohol can aggravate acne rosacea because drinking enlarges the body's blood vessels. When blood vessels are more open, they allow more blood flow to the skin surface, creating a flushed appearance. Heavy drinking over a prolonged period can cause the heart muscle to expand, which weakens it and causes it to work less efficiently, leading to chest pain and heart disease. The toxic action of alcohol, along with nutritional deficiencies, especially of vitamin B1, are thought to be responsible for peripheral nerve degeneration and brain damage. Alcohol can also reduce protein synthesis by causing the body to enter a catabolic state, where the body is breaking down proteins rather than building them. Alcohol can affect the release of hormones needed for promoting protein synthesis. Heavy drinking can also damage the cells in the testes which produce and secrete testosterone. Alcoholism can also increase cortisol, a stress hormone, which can decrease testosterone synthesis. Heavy drinking can irritate or erode parts of the stomach lining, which can leave the stomach lining more vulnerable to the acidic digestive juices normally produced by the body to digest food. This can result in esophagitis, gastritis, or ulcers. If consuming alcohol while pregnant, alcohol can cause fetal alcohol syndrome, which causes increased blood alcohol concentrations in the developing baby. Alcohol interferes with the transport of oxygen and nutrition to the developing baby. It can reduce the development of the fetus's tissues and organs and can cause brain damage. Alcohol can cause high blood pressure by affecting the autonomic nervous system. Alcohol can also cause hypoglycemia because it causes an increase in insulin, which results in low blood sugar levels. It can cause strong cravings for alcohol because alcohol contains a lot of sugar. Because of this, an alcoholic will tend to consume another drink. However, drinking more alcohol forces the liver and pancreas to produce more insulin, which removes sugar from the blood, making the hypoglycemia worse. It is a vicious cycle. Alcoholics often have reactive hypoglycemia, or a fast increase in blood sugar levels followed by a drop. This produces a craving for foods in particular that quickly raise blood sugar, such as sugar and alcohol, which in turn aggravates the reactive hypoglycemia, especially in the presence of alcohol. Hypoglycemia also aggravates the mental and emotional problems of the alcoholic and the withdrawing alcoholic, with symptoms like sweating, tremor, tachycardia, anxiety, hunger, dizziness, headache, visual disturbance, decreased mental acuity, confusion, depression. For years, it has been recognized that approximately 95% of alcoholics suffer from hypoglycemia, or low blood sugar. They also show many nutrient deficiencies. The usual explanation of these associated nutritional disorders is that as alcohol is consumed, in preference to food, as applies to most alcoholics, deficiency and hypoglycemia will result. However, there is much evidence suggesting many nutritional disorders, especially hypoglycemia, precede alcoholism. It appears hypoglycemia may be the cause of alcoholism and not its result. An experiment was performed on rats. One group was fed a refined carbohydrate diet typical of most hypoglycemics. Another was fed unrefined carbohydrates and supplemental vitamins. The last group was fed unrefined carbs and high protein, a diet commonly used to prevent or treat hypoglycemia. Each group was given 2 drinking sources, water and alcohol. The group fed refined carbs, which causes low blood sugar, slowly began to prefer the alcohol over the water until they almost completely gave up the water. The low-protein group drank a little alcohol, while the third group, eating unrefined carbs and high protein, avoided the alcohol. Another study showed that rats fed a reasonably good diet, but also sufficient sugar, also began to drink alcohol. These studies show if hypoglycemia is allowed to develop, ideal conditions then exist for the development of alcoholism. This should not be too surprising when we consider that alcohol is probably the ultimate refined carbohydrate. Alcohol increases blood sugar levels even faster than sucrose. If the person is a social drinker to the point where the body recognizes the rapid blood sugar rise from alcohol, then a craving even greater than sugar becomes established under the right conditions. The original causes of alcoholism may be social, but once the body establishes an alcoholic dependency, a vicious cycle begins where they drink to relieve the standard hypoglycemic symptoms of depression. Tension, irritability, tiredness, inability to think, and so on. The alcohol increases their blood sugar levels, which initially makes them feel relaxed, energized, and generally reduces the hypoglycemic symptom. Gradually, most alcoholics replace what little nutritious food they may still consume in favor of alcohol. Until their diet is even lower in protein and nutrients, which worsens the hypoglycemia and also the alcoholism. The same applies when someone consumes their first drink due to psychological problems. Long after the original psychological cause is gone, the physiological alcoholic addiction remains. Most naturopaths agree that an alcoholic addiction is rare on a proper diet, and believe that malnutrition or an imbalance of nutrients usually precedes alcoholism and is aggravated by it. Other health effects of alcoholism include increased cancer of the mouth, pharynx, and esophagus. Alcoholic drinks contain ethanol, which irritates the body's cells. Over time, this irritation can cause cancer. Alcohol can damage the lining of the mouth and throat, causing cancer in these parts of the body. Alcoholism can also increase serum and liver triglyceride levels. Triglycerides represent the major form of storage and transport of fatty acids in cells and plasma. The liver is the main organ for fatty acid metabolism. Too much alcohol increases the number of triglycerides, which can lead to hardening of artery walls, increasing the risk of stroke or heart disease. The liver breaks down most of the alcohol consumed so it can be removed from the body. The actual process of breaking it down can cause harmful substances which can damage liver cells, promote inflammation, and weaken the body's natural defenses. In some alcoholics, liver function is irreversibly impaired. All alcoholics show some injury to the liver. The extent of fatty liver is approximately in proportion to the duration and degree of alcohol excess. Even moderate alcohol consumption may produce fatty liver in non-alcoholics. Thank you so much for watching this video. If you enjoy this type of content, don't forget to hit the like button and subscribe to my channel for more informative videos on health and remedies. Also, feel free to leave a comment. Do you know anyone who has suffered with alcoholism? Have they experienced any of the above-mentioned symptoms? Don't forget to check out Part 2 on alcoholism, which covers more health effects plus complications, causes and conventional treatments, and Part 3, which covers complementary treatments. I will link them in the description below. Bye for now.